Welcome to this week's conversation with Dr. Stephen Nedd about the body and how to fix, protect, or maintain it using outside-the-box alternative solutions. If you're a big fan of the pharmaceutical or surgical approach, you are so in the wrong place here. Because on this podcast, we're not going to be pushing the conventional medicine methods or even their way of thinking about health. If you're looking for another way to live longer and healthier, join me, Ron Nedd, and my brother Dr. Stephen Nedd for this week's Body Chat about 5 unconventional ways to eliminate low back pain that medical doctors won't tell you about. Me, I'm a retired Twin Cities chiropractor currently helping people buy and sell homes in the Tampa Bay and Los Angeles areas, while Steve has a thriving chiropractic practice in the Clearwater area of Tampa Bay, Florida. In this podcast, we're going to chat about all sorts of topics related to health, nutrition, exercise, just about everything having to do with the body. You're invited to listen into our Body Chat, but don't forget that neither of us is giving you personal health advice, so don't rush off to do something without either checking with your doctor first or seeing Dr. Stephen Nedd as a patient at his office. Good afternoon, Steve.
Good afternoon, Ron.
So this week we're getting into something you've probably dealt with once or twice in your practice, which is low back pain.
Yes, that's for sure.
So low back pain is probably the top complaint that people see chiropractors for. What percentage of the population is estimated to suffer from low back pain? Do you know?
Well, I can answer that several ways. I got my stats from back pain statistics compiled by thegoodbody.com. And during some point in anyone's lifetime, 80% of Americans have back problems. In comparing men to women, it's actually more common in women. Nearly 1/3 have back pain at any one time, and men have back pain about 1/4. 50% of pregnant women have significant back pain during pregnancy, and the majority of Americans that actually have it are desk workers, with 54% compiling that stat. So they say sitting is the new smoking. And there's a really good reference on that, and it's a book called Sitting Kills Moving Heals by Joan Vernikos, PhD, who's a former NASA Life Sciences Division director. Mm-hmm. I actually got to see her at a seminar a few years ago. And she's actually the person who was most responsible for helping John Glenn get back into space at age 77.
Oh.
Yeah. During her research, they found that, astronauts, when they went into outer space in zero gravity, they would come back and they would age rapidly, and they had really bad back problems and so forth. And what she found is that the closest thing on Earth, the closest activity on Earth to that is sedentary lifestyle, such as sitting for long periods or laying down for long periods. Mm-hmm. And so she compiled this information into the book, and she said that the best take home from that book was, if you sit for long periods, you should actually try to get up every 20 to 30 minutes. Just stand up.
Did she say for how long?
Not just maybe for a minute or so, and just stretch and move around a bit. It opposes the force of gravity. And she said, if you go from a squat to a standing position, it's even better. And if you go from a squat and jump from a squatting position, it increases the G-force even more.
Okay, I just have this picture of one of those big offices with all those cubicles and just seeing heads bouncing up above the walls and kind of like this one over here and then one over there, and almost like a little office whack-a-mole thing going on. Anyway, okay. Did I cut you off? Did you have more to say there?
Well, yeah, believe it or not, back pain is the second most common reason people visit a doctor's office. Do you happen to know what the first one would be?
No.
Upper respiratory infections.
Oh, okay.
Yeah.
Well,
especially this time of year.
Yeah, well, we will or won't go into that at some point in the future. Okay. So now, what would you say are the most common causes of low back pain? Obviously, sitting for extended periods of time, from what you're saying, is one of the big causes.
Yeah, most are mechanical or physical things and not serious conditions. So like spraining ligaments or straining muscles, especially from accidents like sports injuries, motor vehicle accidents, or work injuries is right up there. Disc conditions such as degenerative discs or herniated discs is very common as far as causing back pain. Mm-hmm. the thing that we look for in chiropractic is called a subluxation. And if you break that word in half, sub means less than, and the word luxation is a fancy word for a dislocation. And so that can cause an array of issues, especially pain. It can irritate your nerves. It can cause your muscles to tighten up and so forth. And so that's the main thing that we actually look for in chiropractic. Other common causes are arthritis, poor posture, obesity, dehydration. Obviously, we talked about pregnancy already. And even your organs can refer pain to your back. Your colon, kidney. You can have kidney stones causing back pain, or you can even have a kidney infection cause back pain. Your gallbladder can refer pain into the right shoulder blade area. Your stomach can refer pain back there. Your lungs, remarkably, I had a patient that I had to refer to a medical doctor because he wasn't getting better, and they did a chest x-ray and found out the lower lobe of one of his lungs was causing lower back pain, believe it or not. And finally, the reproductive system, it's quite often, quite common for women during their cycles to have back pain too.
That's true.
Yeah. Some of the more or less common but serious causes are spinal fractures, which could be caused by trauma or osteoporosis.
And osteoporosis, for people who are listening that aren't familiar with that term, what is that?
That means that the bone density is not very good. They have a loss of calcium and the material that makes up the bone, so it looks like a honeycomb. It's very porous. And that tends to be with the aging process.
All right. So the bones are not as solid as they used to be, and so they can collapse, and that's the kind of fracture you're talking about?
Yes. Compression fracture is what we call that.
Okay.
Obviously, cancer, again, which is very rare, but it can occur in the back and the spine. And another thing that's interesting that can cause back pain is an aneurysm of the aorta in the abdominal area. Sometimes we see this on an x-ray where you see the outline of the aorta because it has calcium built up around it, and it can balloon up, and that can eventually result in something very serious. And I spotted that on a patient one time and sent him out to the ER immediately, and they saved his life.
Good.
Yeah.
Okay, so from what you're saying, there is a lot of things that can cause back pain, not just your typical, oh, I lifted too much or something like that. So if something's going on, especially if it's not resolving quickly, it would be smart to get it checked out properly by somebody who knows what they're doing.
That's correct.
Okay. So then let's take an example where someone's never really had low back pain before, and they do something minor, like they're bending over to pick up a sock and their back suddenly goes out. What really happens in that kind of a situation? Because obviously socks are not very heavy items to pick up, so it's doubtful that that caused it.
What happens is, more often than not, people throw out their back not from an actual injury, but because of repetitive microtrauma, meaning they're continually doing the same thing over and over again, like bending and lifting incorrectly.
Oh, okay. So that's because I was going to say, if somebody's doing something over and over again, that wouldn't necessarily be microtrauma.
Well, here's an example of that. There was a study done in 1982 by Adams and Hutton et al., and it was published in Spine Magazine. And they suggested that if you bend forward or flex forward at the waist about 28,000 times during the course of your life, you can herniate a disc, which is rupture a disc. And if you add compression to that, like you're bending and lifting something heavy, and you're not bending at the knees, but you're bending at the waist, then that number can go down significantly. So bending at your waist over a lifetime can cause a disc injury instead of, well, you should be squatting or going down on one knee. Even if you just pick up a pen or mail, you should still be squatting or bending down on one knee to pick it up.
In other words, when you're picking something up, rather than bending 90 degrees at the waist to do so, you should keep your torso or your upper body kind of still in the same horizontal, no, that would be vertical, the same vertical position it was, and moving down by bending at your knees and then reaching over with your hand instead of just bending forward from the waist.
Precisely.
Okay. So continuing on along with the microtrauma you were talking about before I interrupted.
One of the things that we do is just make people aware of certain things like their workstation and bending, lifting, things like that, so that they can prevent these types of occurrences from happening. Another similar situation is carpal tunnel syndrome. When people sit and their hands are bent forward too far on the typewriter, over time that can lead to irritation of this nerve that goes in their wrist area to their fingers, and it starts to cause pain and tingling and weakness and things like that.
All right, so that would be the situation where somebody's not had any problems before and they bend over, pick up a pencil, and then they can't straighten up and they're being carried into the doctor's office. It's been something that's been going on over a long period of time with little micro traumas or things that are causing minor amounts of damage, and it just accumulates and adds up over a long enough time that one more thing that's it.
Exactly.
Okay, so that's that case. Now, why would somebody who's always been in really good physical condition, like an athlete, end up with bad low back pain? Tiger Woods is an example. He's actually in very good physical condition. He's an athlete, has been since he was very young, and he was off the tour for quite a while with back pain. So if somebody's, in a situation like that, as opposed to somebody who's playing football or ice hockey, and they don't necessarily get injured in what they do, how would that actually happen for an athlete when the musculature is in a lot better condition, they're not overweight or anything like that?
Well, for one, it could be poor technique. I actually took some golf lessons, and my coach predicted, and this was about 15 years ago, he predicted that Tiger Woods was going to have back problems because of how violent he would swing and the torque that he would put into his swing. And so it's real important that athletes work with a coach and a trainer, and even possibly have video presentations showing that, like baseball pitchers, they often video them to make sure that their throwing motion is correct and so forth. Again, posture is something that's real important, because if their posture is even slightly off, especially elite athletes, they need to be as close to perfect as far as having posture to be at the top of their game. If somebody weighs 10 pounds more on the right, they're leaning to the right, and they try to run a sprint, they may not be able to run a straight line and stay in their lane. That was one of the things that I was excellent at when I ran track.
Not staying in your lane?
No, staying in my lane.
Okay.
Because I got regular chiropractic adjustments. So that was one thing that I knew that was helping.
Okay.
Obviously, muscle imbalances. When it comes to the lower back, the one muscle that I find that is most involved is the hip flexor, the one that lifts your hip up, called the psoas, Psoas. And it could be either tight or weak or both. And it's actually much worse if it's weak on one side and strong on the other than if it was weak on both sides, because it actually not only attaches to all of your lower back vertebrae, but it also attaches to the outside of your discs. And then it finally attaches to the front of your hip. So if that muscle is off, it can create torque in your back, and that can actually lead to disc problems. So I test that on everybody that comes in, with not just athletes, but everybody that comes in. And quite often it tests weak. And then we work on not only strengthening it in the office, but we give patients exercises at home to not just strengthen it, but also to stretch it.
All right. So in that case, you're saying that with some of the athletes, it's technique, and in some cases, it's imbalance in the musculature, which can come about from various different things, including using just one side of the body much more than the other side of the body and overdeveloping it.
That's for sure.
Okay. Now, what is the typical medical approach that you've seen for low back pain, and why is that not the best route to take unless there's something serious going on?
Well, typically people are recommended medications to treat the symptoms, and that would start with over-the-counter medications. It could progress to prescriptions such as anti-inflammatories, painkillers, or muscle relaxants, as well as injections. People oftentimes go in and get cortisone shots, or they get what's called tramadol. Tramadol is actually very popular with professional football players. It works, but it does have side effects.
What does it do?
It just takes the pain away and you feel great.
Okay.
I had a new patient come in just this week who was a former professional football player, and he talked about how most of the players got tramadol before games and they felt amazing, but it did have its side effects.
So they were given the drug before the game, not necessarily because they had been injured or were in pain?
It allowed them to function and perform without having their attention on the painful area. But again, just like all drugs, they do have side effects, and some can be very harmful. There's less harmful injections that can be used, such as prolotherapy, which is the use of saline, which is salt water.
Mm-hmm.
And I know you've had that done.
Mm-hmm.
PRP, which is called platelet-rich plasma, where they take your blood, they take a sample of your blood, they spin it down in a centrifuge, and then they collect the platelets that are left over and re-inject them into an area, whether it's your back or a shoulder or whatever, and it helps with healing and reduction of pain and inflammation. Of course, the new hot thing is stem cell therapy, which helps to heal and regenerate tissue.
All right. And I guess that would depend on what the actual condition is stemming from. If it's a subluxation, then none of those things are going to really fix the condition, but they might alleviate the condition. If it's something like it's just a strained muscle or whatever, maybe something like prolotherapy would be a good thing to do.
That's absolutely correct.
All right.
And one more thing I'd like to add on that is the other typical approach would be later on would be to consider surgery. And there's 1.15 million back surgeries performed in the United States every year.
Mm-hmm.
And that's double the rate of most developed countries and 5 times the rate of the United Kingdom.
Wow.
Yeah. And according to Dr. Charles Rosen, a clinical professor of orthopedic surgery at the University of California, Irvine School of Medicine out in your neck of the woods, he says that maybe 5% of patients with back pain need surgery.
Right.
And, the problem with back surgery is what's called failed back surgery syndrome. And there's a conservative estimate of about 20% of people have failed back surgery, but other estimates are as high as 40%, according to a 2016 study of the Journal of Pain Research. Fortunately, there's less invasive procedures now, including laser, that have a little bit higher success rate. But again, it should always be the last resort. You should always try conservative approaches first before considering back surgery.
Completely agree with you there. So now looking at another conservative approach, some medical doctors are recommending physical therapy by physical therapists for their patients with back pain. And that seems to relieve the pain for some people, at least for a period of time. What's your opinion of this approach?
Yeah, I agree. I mean, it definitely has positive results for pain reduction. It's especially helpful in rehab after injuries and surgery. For example, the electrical modalities, ultrasound and electrical muscle stim, are definitely good for pain relief. Manual therapies like massage and myofascial release are excellent for muscle tension and reduced range of motion. And my favorite is traction, especially spinal decompression, because of its many benefits, including relieving muscle tension, improving posture, relieving arthritis, relieving nerve compression, and opening up fixated joints.
So what are your thoughts about people going to physical therapists for physical therapy and not getting chiropractic treatment? Do you think that that's going to work for most of the people that do that?
In addition to what we do, but they cannot manipulate and adjust spinal segments that are causing nerve interference and loss of function. So a person may have weak muscles, and it may be because the nerve's being pinched directly from the spinal area it's coming from. Physical therapy is not going to be able to accomplish that. So they can get relief, but they'll tend to be spinning their wheels for a while because they're not addressing what's really causing the problem, if indeed that is what it is.
Yeah, I mean, it really depends on the situation, because in the case of a weak psoas muscle or something where there's a muscular imbalance, they won't necessarily dig that far to find that out and correct that. They'll work on getting some alleviation of pain, and then the person will be fine for a while, but the underlying problem's still going to be there, even though it may not be a subluxation. Most of my experience has been with medical professionals, not 100% of the time, but a lot of them, is they really don't want to dig, or I shouldn't say don't want to, but they just don't dig deep enough to find out a real cause behind something. They're good at coming up with a diagnosis, which is a name of something, but that doesn't say why it's going on. And since the people are referred to physical therapists mostly for medical doctors, and a lot of times they're given a prescribed treatment plan, it may not be the correct thing. So in some cases with minor issues, it's much better than the drugs or surgery. But it's not necessarily going to be dealing with something, especially a chronic condition that's been going on for a while, and correcting that if you don't have the proper diagnosis and you don't have the aspect of the subluxation being taken care of. So now let me ask you what you do as far as your diagnostic approach towards low back pain. And why do you feel that's important in the overall management of low back pain cases?
Good question.
Of course it is.
Yeah. So, of course, the first thing I do is get a really, really good history from the patient and get their subjective complaints, because everybody that comes in with a condition, it's a mystery. And I kind of feel like Sherlock Holmes, where I'm trying to solve that mystery of what's causing the problem, not just treat the symptoms, because it takes a little more time, a little more work to really figure out what's underlying and what's causing it. So not only do we do that, but of course we do thorough objective testing, which is measurements and things that we can observe to see what could be out of balance or causing this. I also look at their feet, because your feet are the base of the whole body. And if your feet are off, if they're flat, or if they're turning inward, which is called pronation, which is actually very common, then it can translate all the way up the body. And we use foot inserts called orthotics quite often to help people with that, because even if we do everything correctly, we treat them, we do a chiropractic adjustment, if their feet are off, they can walk by the time they get to their car. If their feet are throwing the back off, then they're not going to hold their adjustment very long.
Okay. So why is it important that you do that way? I mean, we're not going to get into necessarily all the details, but your approach is to make sure that you trace it down back to what the cause is and what the real reason is behind their back pain. And why is that so important?
So that we can be very precise as far as helping the person overcome whatever is causing their back pain, instead of just, again, treating the symptoms. Because we're just treating the symptoms, then their case probably won't ever resolve, and it'll just continue to persist. And sure, they might feel a little bit better here and there, but if we have a shot at getting them completely corrected and then to maintain that correction, that's what we're going to go for.
Very good.
Yeah.
So now, what are 5 unconventional ways to eliminate back pain that medical doctors don't tell people about?
Well, the first one, definitely at the top of my list, is cold laser or low-level laser therapy.
Mm-hmm.
There are some that are familiar with it, but it's become more mainstream now in the last 10 years. I started using cold laser therapy back in 1999. And about 4 years ago, I worked at the spring training complex of the Toronto Blue Jays in Dunedin, Florida. And most of the physical therapists were using cold lasers in there. I was very impressed.
Mm-hmm.
Cold laser produces a beam of light. It's very non-invasive. You don't feel anything. There's no heat, and that's why it's called cold laser. And the one I like to use is microscopic.
Mm-hmm.
It works at the cellular level. And we use different frequencies to help different tissues, because medical research has found that different cells of the body like to work best at certain frequencies, which is the vibration rate. Other things that are unconventional would be acupuncture.
Mm-hmm.
Acupuncture has been around for thousands of years. It's just in recent times been researched, and it is being recommended even more by, believe it or not, medical doctors. An offshoot of acupuncture that I've been trained in is dry needling, which is more of a Western medicine approach. It deals more with modern science than it does with traditional Chinese medicine.
Okay. So that's number 2.
Yeah. Number 3 would be supplements. Most medical doctors get very little training in nutrition during their 9 to 13 years of schooling. The ones that do tend to do independent research on it, and I take my hat off to them for that. One of the things that I've found that's really helpful is omega-3 fatty acids in the form of fish oil. And the only problem with that is most people don't take enough. In order to get the right amount to reduce inflammation, you need to take at least 3,000 milligrams a day. And so that's one of the things that we educate our patients on that already are taking that. Magnesium is another thing that works great as a natural muscle relaxant, and you can take it in the form of a pill or liquid or powder, and you can soak in it. Epsom salt is actually magnesium sulfate, and works great for that. There's many other examples that I can give on that too. Maybe we'll do another podcast on that in the future.
Sure.
Another thing would be an anti-inflammatory diet. And that means that you're controlling the food that goes into your body that can cause inflammation. And so typical things would be dairy products, red meat, and gluten, in particular wheat. Those are the biggest offenders as far as inflammation. And then finally, well, I guess...
So no cheeseburgers then?
No, doggone it.
Cheeseburger.
Yeah.
Okay, so now what was number 5?
That's chiropractic.
Okay.
Although I don't know if it's really considered unconventional anymore. It's become more mainstream. But I would say probably not the majority of medical doctors are still recommending chiropractic to their patients. So I think it qualifies.
Well, fortunately, some of them are at this point, so they're not all complete idiots. All right, so now what are some tips you can give people to prevent low back pain?
Well, of course, something we've already gone over, which would be sitting less. And one of the ways you can handle that, especially at the workplace, is to get a standing desk.
Mm-hmm.
And I have one at home. It's great. It's made by IKEA, and it's motorized, so it allows me the ability to either stand or sit. So that would be one thing. Obviously, don't bend at your waist if you're lifting anything or bending over to pick up something, whether it's a heavy box or a paper clip. So squat or go down on one knee.
Okay.
Sleep on your back with pillows under your knees. That's a big thing there. That helps flatten the back out and take the stress off of it. And if you're a side sleeper, then put a pillow between your knees.
Okay.
Everybody should stretch every day too. And whether it's yoga or the use of one of those big round stability balls or just regular stretching, that should be part of your daily routine.
Okay.
Core exercises are excellent for strengthening the muscles that support your lower back. And you can do that with a personal trainer, a Pilates instructor, or just get some videos and do that.
Now, why are they called core exercises, or what is it being exercised?
Well, the core is the center of the body that makes up your trunk, and that is the muscles that actually support your lower back. And so you can work your abdominal muscles, you can work your inner core muscles. We actually have exercises that we give our patients to work the inner core muscles because most people are already doing exercises to strengthen their abdominal muscles.
Okay.
Another thing that you wouldn't even think about is drinking more water. You know, your muscles are made out of protein and water, and you should drink about half of your body weight in ounces. And what I like to tell my patients is your muscles are like a nice steak, and the juiciest steak is probably a filet mignon. And the reason it's juicy is because it has the highest water content. But if you don't drink enough water, then your muscles end up being like beef jerky. And most people can pretty much relate to that. They're like, oh yeah, I get it now. Okay, I'll definitely drink more water.
Yes.
And then finally, see your chiropractor monthly for a maintenance visit, just like taking care of your car. That's a great tip because even if you feel like, oh my, I feel great, well, you can't tell if you have a hidden subluxation or subluxations, which can eventually lead to health issues and back problems.
Excellent. Great suggestions. Now, is there anything else you'd like to say on this topic before we end?
Yeah, a couple things. I mean, most back problems are preventable by just being alert and aware and following some of the simple recommendations that we've already given. Always try the most conservative approaches first because you can always turn to drugs and surgery later. And I'd also like to add that there's another stat that's really upsetting to me, and that's that 90% of patients being treated for back pain don't know the primary cause of their pain. It means either that they didn't ask, or the doctor didn't tell them, or the doctor didn't know and was just treating the symptoms.
Okay. Very good. Well, thank you for all that information. Next time, we're going to be talking about neck pain. And then after that, I think we're going to talk about diets because it's that time of the year coming up for people to want to get rid of all the weight they put on from the holidays. So thanks again, Steve.
Thank you.
You're welcome. Thanks for joining us this week on the Body Chat podcast. We both really appreciate your time and your attention. We want to provide you with interesting and informative episodes each week, and if you have a topic you'd like us to cover or any questions you'd like us to answer, send an email to us at info@bodychatpodcast.com. That's info@bodychatpodcast.com. Next week, we're going to chat about 5 unconventional ways to eliminate neck pain that medical doctors won't tell you about. And the week after that, we'll be talking about a better way to lose weight and keep it off. To make sure you don't miss any of our upcoming episodes, subscribe to the Body Chat podcast now on iTunes, Stitcher, Google Play, or Spotify. See you next week.